My study was about the sequence of treatment for patients with advanced metastatic colorectal cancer. We knew in the past that there were two drugs that were able to improve the overall survival of these patients, regorafenib and trifluridine tipiracil, but we didn't know what could be the best sequence to start with rego first or to start with trifluridine tipiracil first. And the aim of the study was to evaluate the two sequences, rego followed by trifluridine tipiracil or trifluridine tipiracil followed by regorafenib. It was a randomized phase 2 study. And at the beginning of the study, it was planned to include more than 300 patients in the study, but we stopped the accrual following the results of the SUNLIGHT trial, showing that trifluridine tipiracil is more active when it is given in combination with bevacizumab. The results are very clear. The sequence trifluridine tipiracil followed by regorafenib is a better sequence with more patients that are able to receive at least 2 cycles of each drug. 60% of the patients could have that in this arm. At the opposite, the patients receiving first regorafenib had some problems with toxicity, and it was less easy for them to receive, after progression to regorafenib, to receive trifluridine tipiracil. So this is in terms of possibility of doing the two sequences of treatment, but there are also positive effects in favor of trifluridine tipiracil followed by regorafenib in terms of control of the disease, and particularly in terms of progression-free after receiving the two treatments. So this is really, there are absolutely no problem. This is really in the advantage of the sequence trifluridine tipiracil and then regorafenib. These results are very consistent with what we obtained after the SUNLIGHT results. It means that now the standard of care for third-line chemotherapy of metastatic colorectal cancer is really trifluridine tipiracil plus the addition of bevacizumab following the results of SUNLIGHT, and that we have to keep regorafenib for fourth line when patients have a tumor that is progressing when they receive trifluridine tipiracil plus bevacizumab. No, I think this is a study that gave very clear answers. We are working in terms of translational approach to try to define the patients that are best benefiting from regorafenib.